for the record. So let's get straight back to our panel as we continue talking about a week full of news about employers setting requirements for staff to get vaccinated. So we touched on this a little bit in the last break. Let's go further into this, why each of your organizations are making these requirements. So first, let's again turn back to the health side of our panel. First for that, particularly in Dane County, we're seeing rise of COVID everywhere. Let's talk about the health reasons why this might be important now.
Yeah, it's important, as I mentioned earlier, to make sure that our healthcare providers and givers themselves are vaccinated, are protected, so they don't come to work fearing they may get COVID and they may take the infection back home to their loved ones. So we want them to feel safe, that knowing that they themselves are vaccinated, their coworkers are vaccinated, but also for our patients to know that they can come to us and feel safe, that they are here taking, receiving care without fearing that they may get COVID themselves. And I want to add also another comment here. We all know that there is a level of vaccine hesitancy in the community. And one of the ways to help those of us in the community who are on the fence as to whether they should get the vaccine or not, it helps when they know that their physicians, their nurses, their pharmacists, their caregivers, they're all vaccinated. That certainly can help them make the decision to get the vaccine themselves.
I would agree. I think it was extremely important that healthcare stepped forward because unfortunately this issue, like so many others, has become polarized, throughout the nation. And these are the folks we trust. These are our healthcare providers. They're the folks we turn to. And if we see that they're comfortable taking the vaccine and mandating the vaccine, I think that goes a long ways because what's really important here, and one of the things that is really driving our decision making is we talk about numbers and percentages of people vaccinated, but the bottom line for me is for kids under 12, the percentage of vaccination is 0 because our kiddos can't get vaccinated yet. And I feel that it's vital that everything we do be looked through the lens of the young people we have a responsibility to take care of and to keep safe. And we all need to lead by example, and we need to think about how our actions impact the most vulnerable among us.
And Dr. Letzer, I think we can't have this conversation without also touching on at least the kind of the troubling rise in COVID cases right now, statewide, Dane County, wherever we're talking about in the state. If you want to touch a little bit on that and what we need to do to get that back down.
Yeah, I wish it was more complicated, but really it's about vaccination. If you look at hospitalization rates, 98% of those or higher are basically unvaccinated. This right now is essentially a disease of the unvaccinated. So I think the way through this, as Joe mentioned, really it's about getting vaccinations. I wish it was more complicated so we had more excuses for why we're not where we want to be. But it's really just about getting vaccinated. And we are seeing the rise, and we're seeing rising cases in the hospital in younger patients than we did in the previous surge. So we're seeing patients now in the age range of 20 to 50, and almost all of them really are unvaccinated. So there's really a shift in this dynamics to a little bit different demographics, but the commonality is everyone's basically unvaccinated.
As we kind of wrap up this conversation, thinking about what we may have missed, if all of you can kind of jump in with some of your final thoughts, but also I wanted to touch something, Dr. Letzer, you mentioned even before we started taping. There's kind of a weariness involved here, right? All of you have been dealing with this now, especially in healthcare, for 18 months. I mean, it still feels like we're in this for the long haul.
No, I don't think anyone wants this pandemic to be over with more than the folks on this show here tonight. And I look at our healthcare providers and I don't know how they do it. And I just have the utmost respect for them. And the best way our community can show our support for our healthcare workers is to get vaccinated, to heed their advice. And let's put this pandemic behind us once and for all. We know how to get there. We just have to do it.
Yeah, there's like we spoke before, there's a real emotional and psychological fatigue. And, talking to ICU nurses and nurses on the floor and other providers, I mean, we're all kind of having the same conversation. Can we emotionally go through another surge like we did before? And so there's a real emotional part of this that we're invested in trying to hopefully move the needle to get people vaccinated so we don't have to experience the same thing again.
Yeah, I agree. And the vaccine is available, unlike, the way it was a few months ago when we had to ration as to who can get the vaccine. Now it's available. Anyone over 12 can get vaccinated. It is available. It is free. It is safe. It is effective. It works against the new variants like the Delta variant. And the solution to this pandemic is really in our hands. And it's by getting the community vaccinated, reaching herd immunity levels 80 to 90% is what will help us get to a point where we end the pandemic. The problem is the longer it goes, before we reach the herd immunity level, there's more time for the virus to evolve even more, and the risk is to see other variants that could be even more contagious, and that's the real concern that we have here.
It's really the vaccines are doing what they're supposed to do. I don't want the misconception that these quote unquote breakthrough cases are failure of the vaccine. The vaccine was created really to prevent serious disease. It never was created in order to prevent just being infected or acquiring the virus. It's doing what it's supposed to do. These aren't really true vaccine failures. So people shouldn't be hesitant based on the fact that they think the vaccine is failing. I think that's a misconception that's out in the media and the public, and I think it's important for us to dispel that. And Mo's shaking his head, and it's good to see that he's in full agreement with that as well. So,
definitely.
I'm glad you raised that point. Again, thank you all so much.
My pleasure.
All right, thanks so much for taking the time to join me today. You can recap those conversations and our reporting on those rising COVID-19 cases throughout Wisconsin. That's all on Channel